Hi, I'm Rajkumar from Chennai, Tamil Nadu. I had this fistula diagnosed last year, July 2020. So I took medicines for 5 months to see that it is cured, but it not cured, it was reoccurred. Then I went for surgery called Sharasutra treatment, which I took in December 2020. It is very like painful treatment. Every week I have to go through this Sharasutra change, and I took a lot of painful tablets because it was paining. I have to take painful tablets and ointments, etc.
This patient, Rajkumar from Chennai, had a complex fistula nano. He had a Peri-Anal Abscess and landed up in a hospital where they did an incision and drainage, and subsequently he developed a very bad fistula. He had 2 internal openings and multiple tracts, and he went to many hospitals in Chennai. Many hospitals said he needs multiple sittings, he needs some sit-in. Totally he was confused. Finally he landed up in an Ayurvedic hospital and went for Sharasutra.
And last week what happened is I had severe pain which is intolerable. That is where I started thinking about and exploring alternate treatments. So in Chennai itself I have consulted big hospitals to understand the kind of treatment that I need to go through in allopathy, and most of them said that no, I have to since I have complex fistula, it is bit complicated. I have to go through some 2 to 3 surgeries to recover, and also there is lot of risk is associated with these treatments. Basically they said risk of incontinence. I cannot have control on my stools or urine, and it's a reoccurrence. So there are different types of risk associated.
He was not happy, he was suffering with pain, and there was a mess and misery in his life every day. He could not deliver his day-to-day activities, he could not go to his office, he could not perform any duties. An interview appeared in Times of India, and I did give the interview on colorectal problems and awareness. By seeing that interview, he had called SMILES and he reached to SMILES from Chennai.
So I was bit confused. Then I have seen this SMILES advertisement in Indian newspaper in the month of December. I have taken the snapshot, and my wife was telling that why don't we talk to this hospital, understand what they are doing it. That's where I started speaking to the health experts. I think when I spoke to them, I got a lot of good understanding about this fistula problem, and I also asked a lot of questions to them. The way the health experts answered to my questions, I thought he's a doctor. So to that extent he was trained, and then I got some confidence, and then next day I have listed out some 15-20 questions, and before that he had shared a lot of technical contents about this problem in the form of fistula brochure and corporate brochure, and that brochure is self-understanding, that has given very nicely what is this problem, what are the causes, what are the symptoms, what are the different treatments. So it has given a very good understanding going to that particular brochure. Based on that, I had asked a lot of questions. Next day some 15-20 questions I asked to that same health expert, and he answered me most of the questions, but still some of them I was not convinced. I told him that I need to have an online consultation with the doctor directly. He had given Dr. Parameshwar mobile number. I was trying to message him in WhatsApp what is the problem I am facing. In fact, I shared my MRI scan reports. Then I talked to him. So he was very patiently listening to me. Almost 30 minutes interaction I had with him. I was trying to explain him the problems what I faced for past 1 year. So he was patiently listening to me, and he asked also some few questions which I answered. Then he clearly explained me that there is no risk associated with this particular laser surgery, and it is completely curable. There is no recurrence chances. So I got a lot of confidence. So within 2 days time I have decided to travel to Bangalore. Though I had struggled this for years, within 2 days I gained a lot of confidence, and he also infused me confidence. Then I planned for traveling to traveling to Bangalore from Chennai. So Monday I came here, Monday night I got admitted.
Very first day we assessed it was a complex fistula. We did endo-inner ultrasound scan. The very next day we operated. Next day morning he was doing yogasana in our hospital. He was back to work in less than 48 hours. Very happy Rajkumar now, doing great.
And the kind of hospitality, the way people have treated me was very nice. The foremost thing is, whenever we go to other hospitals, getting an appointment from a doctor itself is very cumbersome. It's not easy. We have to go through multiple cycle or channels. So here I was surprised. I was able to talk to he is a founder or MD of this hospital, SMILES, and he was able to directly contact him. So that was surprising me, and I think, and he had given me a lot of assurance that this problem will be 100% will be cured. He said like 97% plus or minus 3% is there. Once I get operated, I will say 100%. So it has to be removed from the root. That's what he told. So then I got operated, and then after the surgery, I also had a word with him. So he also mentioned that your whatever surgery had been done to me, it will not have any recurrence, 100% curable. So the kind of it was painless. I told earlier I have undergone Sharasutra surgery. Almost 2 months I had sleepless nights. I had lot of pain. Even painkillers are not working actually. To that extent I had pain. But here it is a complex surgery they have done. Next day, I'm not feeling like I have done an operation. There was no pain, absolutely no pain. So I think it was like fantastic experience for me, because I had a complex problem and they had attended, and very nicely they have attended it without any pain, and surgery was also completed successfully.
After Rajkumar, we got many patients from Chennai who underwent the same kind of procedure. Thank you.
So it was a nice experience. I think many people are suffering with this pain. I think once we come to SMILES hospital with the pain, definitely we can go back with a smile home. That's what my understanding. Thank you.